How do we use calcium channel blockers to treat angina? Well, remember that basic problem with angina is that the output from the heart is less than the needs of the body, specifically the need of the heart's own oxygen supply. What do I mean by that is that what happens in angina is that the heart is pumping out blood. Some of that goes to the body, but some of it goes back to the heart to supply the heart's own oxygen demand. So if the oxygen demand is greater than what the heart's output is, we then have reduced oxygen availability, and that causes pain and eventually worse things. So there's two ways of doing this. We can either reduce the demand or increase the output of the heart. So what calcium channel blockers do is they focus on decreasing the demand and increasing the output. So they do both. How do they do that? Well, first of all, they decrease the demand by decreasing cardiac output. So you remember that in the cardiac myocyte, you have an action potential which opens these calcium voltage gated calcium channels, and then calcium then floods in to the myocyte. So this is meant to represent the T system here. Calcium floods into the myocyte, so you get this calcium rise, and that results in, here we have the endoplasmic reticulum, that also results in calcium being released from the ER, and that contributes to this rise in calcium, and that's what causes the contraction. So if we can reduce this, then we also reduce the contraction. And because this rise here, what we do is we actually block some of these channels so that less calcium comes in and less then is released from inside the cell. So that's how calcium channel blockers such as verapamil, they reduce the demand. In terms of increasing output, one way of doing this is actually to reduce the resistance in the blood vessels. Because if you make a blood vessel bigger, you can get more flow going through the blood vessel for the same amount of pressure. So how do we do that? We cause vasodilation. We want the muscle to actually relax. And to remember that just as in the cardiac myocyte, if you look closely at the structure of a blood vessel, you have the lumen here. You also have this layer of contractile tissue, smooth muscle, just under the lumen. And each of these muscle fibers is controlled by the amount of calcium entering in the cell. So once again, what we seek to do is to block these receptors, to block these calcium channels, so less calcium comes in, and so we get decreased force of contraction, And so the result of that is effectively the blood vessel dilates, getting a bit emotional about it, calcium channel blockers. And so this is what we get, decreased resistance. So effectively for the same amount of pressure, the same amount of work, we actually increase the cardiac output. So that then is how calcium channel blockers are used for the control of angina.